this is Mayor Wallace, and I'm here with Dr. Royce Avery from our school district, and we will give a couple minutes for people that may be trying to tune in for this Manor COVID-19 Level 3 announcement. All right, so Manor wanted to go live with this announcement, basically just to inform you all that the City of Manor is now at a level 3 regarding COVID-19. And basically level 3 is there has been a confirmed case, however, it is no person-to-person transfer of the COVID-19. Again, we do have a confirmed case of someone that was within our city limits with positive COVID-19. However, we do not have any confirmed transfer from person to person. And with that, I'll go ahead and hand the mic over to our superintendent, Dr. Royce Avery, to give some more specifics.
Thank you, Mayor Wallace. Manor ISD community, as we continue to move through this uncertain time, Manor ISD administrators are doing everything we can do to update you on the spread of the COVID-19 virus. We have received communication from one of our Manor ISD staff members that they have tested positive for the virus. That individual, who works at Manor High School, was diagnosed as a positive case Tuesday, March 24th. The individual visited Manor High School campus on Monday, March 23rd, unaware that they had contacted the virus. The Manor High School's campus has been closed to the public since Friday, March 13th, and only Manor ISD staff with special permission has been allowed to enter that campus. Unaware that this individual has contacted the virus, our janitorial staff, per Manor ISD protocols, went into the empty building and disinfected the area the person occupied. That member did not have any physical contact with the janitorial staff and any other member during that visit. According to state officials, the virus can live on surfaces for several days, and for that reason, the 2 janitors who clean the area will be self-monitored at home for 14 days. Under CDC guidance, schools, Manor ISD campuses and buildings will continue to be closed and will only be open on a case-by-case basis. We're waiting for further guidance from our health authorities on what further steps, if needed, to be taken. Manor ISD will continue to monitor this situation and bring you updates as needed. Mayor Wallace?
Thank you, Dr. Avery. And as Dr. Avery has said, and this message will be going out to those within the school district, and I'll get a copy and we'll make sure it is posted on our local pages as well. But again, there is nobody at this campus during this time, so it is not assumed that there is any person-to-person contact. They have talked to the individual that has come forward to inform the school district of their situation, and has also confirmed they did not have any other type of person-to-person contact. I do want to say that it is needed for individuals like this employee of Manor Independent School District to come forward and let us know if you happen to be positive with COVID-19. We do have multiple things in place already to implement for support, for assistance for the community and for individuals as well, but we cannot implement those things if we do not know the true state that the city is in regarding COVID-19 and positive cases. Dr. Avery and I were planning to do a teletown hall at the end of this week, especially given the new online program that has been rolled out yesterday. And some of the topics we're going to talk about then, I feel that it's very important to go ahead and express those now, especially given us now being at a level 3 regarding COVID-19, which is positive case, but no person-to-person transfer. Some of those things are the City of Manor has been working on an emergency management plan since day one. That emergency management plan has had an emergency response team, of which Dr. Avery and a school board member have been designated key and essential within our 6 individuals working this plan. These 6 individuals are working on 6 separate task forces. These different task forces are focused at figuring out how to best be able to support this community when and ever it comes to need regarding food, regarding assistance in being able to transfer these foods to individuals, regarding the school district and schooling, as we're now more of a homeschool city, as well as health, and looking down here, some more things, faith-based. We know that these times are stressful, especially with the new shelter-in-place order that just came out at noontime today by our county judge and goes into implementation at midnight. We know that these stressors are going to increase, and we have been planning for these things from day one, but we do not know when we need to implement these things unless you come forward and let us know who may be positive for COVID-19, or if you are positive for COVID-19. That is the only way we can make sure everybody else's health remains well. And with that, some may not know, our elderly population are 28% more likely to be infected by COVID-19. 28% more likely than anybody else. The individuals being hospitalized right now and sometimes experiencing liver damage, kidney damage, or potentially something else are the ages of 28 to 44. Again, those aged 28 to 44 are the primary individuals that are being currently hospitalized by positive cases of COVID-19. And most of you have heard that this COVID-19 is 3 times more infectious than the flu because it is a virus that has never been experienced before. It is reinfectious. That means you can get it, get over it, and potentially get it again the same day if you are not using the proper protective measures. When we're talking about the flu, we almost lose 70,000 individuals per year by the flu. This virus is 3 times more infectious than the flu, and we currently do not have a vaccine for it. We're looking at several months to hopefully have a potential vaccine. Us being sheltered in place is key to ensuring that we help each other not succumb to a virus that could potentially make them, their immune systems and their body organs less functional than they are right now until a vaccine can be produced that actually prevents this infection from existing within the body. So we need your help, we need your assistance. If you know of anyone that happens to be positive, please inform us, because we are more focused on taking care of the community than being able to point fingers at who probably just didn't know they had it, or who may not have known that they didn't probably wash their hands. It is time to take care of each and every single one of us by letting each other know who may and who may not have it. Thank you.
Mr. Mayor, I think the one added point from the school district side, as we move forward, being able to have additional food for our children that may not necessarily have the means to be able to have food, we will continue to provide our lunch and breakfast service to our students at the 3 locations: Manor New Tech High, Manor Decker Elementary School, and Blake Manor Elementary School from 11 to 12:30. We still will continue to provide those additional academic resources You have the online resources currently at your disposal. Parents and community, we will start doing the academic packet starting Monday. Again, we have to maintain a sense of urgency of being able to provide these services for our kiddos in the district. And we will, as a district, make sure that the safety, security of not only the children and our families, but our staff members as well, and administrators, doing the necessary protocols, guidance from the CDC, making sure that everybody is safe in this working environment, this limited working environment. So again, I want to assure, like the mayor said, there are city task force that specifically are geared to the essential elements of what will make this community great and continue to be great. And again, the school service to kids and families is an integral part of that. I'm part of that task force, and thank you, Mayor, and your committee to be able to really make sure that we stand strong and united to doing great things for this community. And so I appreciate the ability to be part of that operation as well.
In closing, with the new order from the county judge with the shelter in place, if you have not read it yet, it does say the new social distancing has gone from 6 inches to 6 feet. When you go into Walmart, you should see now the retaping that they have done now meets that new guidance of 6 feet. Going out and engaging and kind of socializing in the previous number of 10 or no more now is highly pushed to just you and your immediate family. Unless it's for some other reason you need to congregate and gather with other individuals to do essential business, then you need to still be 6 feet apart. That is the new social distancing, 6 feet apart. Thank you.